Hi, I'm Mallory, and today we are videoing lab draws off of a PICC line. So first thing I would do is check my MAR, make sure that I know what the order is, and I have all my supplies for that order. In this case, just verifying that there is actually orders for a lab draw off of a PICC line, and making sure that I have the right tube for the order. So I'll go ahead and enter the patient's room. Knock, knock, knock. Hi, Joseph. My name's Mallory. I'm going to be your student nurse today. We're just going to get some lab draws off of your PICC line. I'm going to go ahead and wash my hands. I'll also provide for privacy and explain the procedure to our patient. Joseph, first thing, can I get your name and date of birth?
Yeah, Joseph Smith, 3/1/1968.
Okay, perfect, thank you. And that matches my MAR as well as the ID band. And Joseph, do you have any allergies?
Nope.
Okay, perfect. That also matches my MAR. So I wash my hands, and the first thing I want to do is assess our PICC line. I'm going to take a look at the site and watch for any signs of infection. I also want to double check that we have greater than 4 French, which we do. This is a 5 French here. We would want to identify which port we're going to be using. In this case, we're using the proximal one, so it's going to be the white. So yeah, again, wash my hands, and I'll put on clean gloves. Okay, so first things first, if there's an IV running off of the line, we want to make sure to pause the infusion, and we need to wait at least 2 minutes before we do anything with that line after we pause it. So I'll just make sure that the tubing is clamped. I'll pause it on the channel here. I'm going to make sure this is clamped as well, and then I'll go ahead and unhook the IV. So again, waiting 2 minutes, making sure that at least 2 minutes. Also, we want to check to see what our agency policy is, so we know whether or not there's a heparin flush either in the line right now or if we need to do one afterwards. In this case, we'll say there is not. It's just saline locked, so we won't worry about the heparin flush for today. So I'm going to go ahead and alcohol swab the end here. Making sure to do it for at least 15 to 30 seconds. And I will attach my first flush, making sure to remove the air bubble. Sorry, that in the garbage. Remove the air bubble, attach our first flush. Because it is a PICC line, we want to make sure we're using the pulsing method. So we're going to pulse that flush through as soon as we unclamp the catheter. There we go. And if this were a child, I would just want to probably have either another nurse in here to help with distractions, or their parents, if it's appropriate, to just make sure, just keep them distracted so they're not messing with anything while I'm in the middle of the procedure or doing anything that can cause infection or anything like that. So once we have the whole flush in, we're going to go ahead and aspirate with the same syringe. So we'll pull back gently, not super hard here, and we want to pull back a full 10 milliliters. And one other point, if they did have TPN running, we would always want to make sure to not use whichever port they had the TPN running in. Okay, so we have our 10 milliliters here, so we will recap that, maybe. This would go in a biohazard container, and then I'll use another, oh, I would clamp that first, sorry, I would clamp that before I pulled that syringe off. I'm gonna use another alcohol swab, again, 15 to 30 seconds, cleaning that off. And then at this point we would use our empty syringe. And the vial that we have only requires 4 milliliters, so I'm gonna pull back, again, pulling back gently, but I'm gonna pull back 4 milliliters of blood. And I would need to unclamp that, obviously. Okay, so I have my 4 milliliters of blood. So I'm going to, again, clamp the tubing, all while maintaining sterility of this cap. Unhook it and recap it. And now before this coagulates, I'd probably want to go ahead and take care of the blood sample. So I might apply either an alcohol impregnated cap at this point, and then come over here, because this would still be sterile. I can take the lid off of this, and this would also be sterile. So we will attach these. And then you just pop this on. It's going to automatically fill to the amount that we need. And it's done filling, so we'll pull that off. I would dispose of this in the sharps container. This, because there's still a little bit of blood in it, I might also recap that and put that in a biohazard trash as well. Again, sharps container. So right after I do this, I want to make sure and do 8 to 10 gentle turns, just to make sure it doesn't coagulate. And then make sure to put a label on it with the patient's identifying information. Even have the patient give me his name and date of birth, make sure it matches what I have on the label. And then I'm gonna put this into a biohazard bag with the requisition forms or any other paperwork that my facility might require. And I would hand that off to lab or a med tech or whoever is assisting me in that case. So then we need to come back over here and we're gonna finish up. So I will alcohol swab again, once again, 15 to 30 seconds. I will take my second flush, make sure there's no air bubble in it, attach that. Once again, unclamping, using the pulsing method to make sure and flush that through. Okay, I'll unhook that. That's garbage. I'm gonna I would clamp before I unhooked the saline. Alcohol swab again. 15 to 30 seconds. Get my last flush, remove the air bubble, attach the syringe, unclamp, pulsing flush. clamp my tubing. Put that in the garbage. I would once again apply an alcohol impregnated cap. At this point, because they did have IV fluids running, we could rehook that up. And I would just clean up. I'll dispose of everything in the proper place. So I'll remove my gloves, wash my hands. I've already taken care of these, but once again, sharps container, these could go in the garbage, these would go biohazard. Throw everything away, and then make sure the patient is comfortable, lower the bed, make sure they have their call light, everything is good, make sure they don't need anything else. I'll wash my hands again, and when I leave, I will document, just notating the date, time, and what was done.